Mastitis is the most costly disease faced by dairy farmers. A key tool in any mastitis control program is the use of dry cow therapy and/or Teatseal at dry off.
Whenever we use intramammary tubes to either treat or prevent mastitis in dairy cows, it's really important to observe strict hygiene during the process. This is because if we introduce bacteria, we not only reduce the effectiveness of the product, but also we risk mastitis. This applies not only to when we treat clinical mastitis during lactation, but also if we're using dry cow therapy or Teatseal at dry off. Teatseal, or Orbeseal as it's known in some countries, forms a plug in the cow's teat canal. This prevents the entry of bacteria over the dry period, which reduces mastitis both at calving and early lactation. In this video, we're going to demonstrate how to administer dry cow therapy in combination with Teatseal.
The same principles apply if we are using Teatseal in heifers before calving. Administration of intramammary products requires strict hygiene, and preparation is the key. In herringbone sheds, use one side for your gear to minimise the risk of contamination. I prefer using the open side, with the cows rode up on the wall side to allow more light in, making the job much easier. Wearing an apron or belt with pockets makes the job a lot easier, and wearing gloves is essential to maintain hygiene. Load enough tubes to treat one cow at a time, as this makes it easier to keep track of which quarter you are treating. If the conditions are cold, the Teatseal container with the Teatseal tubes inside should be placed in a warm water bath bucket, as shown here. It is very important that the tubes are not placed directly into the water bath. To maintain good hygiene, wash and dry your gloved hands between each cow. It is important to disinfect and treat one teat at a time to reduce the risk of contamination. I like to start at the left front teat and move clockwise around the cow. Left front, right back, and then left back. Treat one side of the teat wipe as the disinfecting side and the other side as the dirty side in contact with your hand. Vigorously rub the teat end using your thumb and repeat 3 to 4 times, moving to a clean section of the teat wipe. If the wipe appears dirty, repeat with the new teat wipe until it is clean. If you're using cotton wool swabs soaked in meths, it is important to apply the same principles as if you are using teat wipes. If there's any doubt about the disinfection or the teats get contaminated before treatment, then repeat the disinfection procedure. When using Teatseal alone, carefully inject the contents of the tube into the teat. Do not massage the Teatseal into the quarter, as it is important that the Teatseal stays in the teat. Spray the cow's teats with a high strength concentration of teat spray and clearly mark her so that you know that she has been treated. When using dry cow therapy in combination with Teatseal, it is important to use the same strict disinfection procedure before inserting the dry cow tube. The dry cow antibiotic must be massaged into the udder before Teatseal is administered to prevent the products mixing together. As you have touched the teat with your gloved hands, it is now necessary to re-disinfect the teat prior to the administration of Teatseal. Using the same technique, carefully insert the Teatseal tube partially, about 3 mm, into the teat canal to minimise the risk of damage to the teat. Again, spray the cow's teats with a high strength concentration of teat spray and clearly mark her so that you know that she has been treated. After the cows and heifers have been treated, it is important for the farmer to walk through the paddock every day in the first 1 to 3 days after administration to check for signs of mastitis. If there are any swollen quarters, or there are any heifers or cows that look sick and not grazing, then they should be brought back to the dairy for examination. Seek veterinary advice as to the most appropriate treatment for these cows. Poor teat disinfection increases the risk of severe mastitis. It is not acceptable to disinfect the side of the teats and to use the same dirty teat wipe on the teat end. Using a wipe in this manner will mean that you are using a dirty part of the teat wipe that has already touched the sides of the teat. Using mess by itself is also not acceptable. Spraying mess is not good enough, as you need to physically scrub the end of the teat to get rid of any organic matter to adequately disinfect the teat end. If the end of the tube becomes contaminated, you must always discard that tube and start with a new one.
Teatseal is well proven to reduce mastitis in both cows and heifers. However, strict hygiene is critical for its success. For further information, please talk to your vet.